Thank you, Johan.
Is this working? Yeah, good, good. Okay, so this was actually my longest presentation, but the discussion is important, so I'll try to go fast. And this is really the one where I was asked to speak about our experience in building a sustainable patient organization. So I thought I'd give you a short introduction and history of IPOPI, and I'll talk to you about how we are structured as an international patient group, and then I will highlight some key factors that I think are important when you develop a sustainable global patient organizations. So as you know, I've said it this morning, we are the Association of National Patient Groups, and we work really towards improving access to care for PID patients and raising awareness for community on a worldwide basis. So we actually are 23 years old. We are a young adult organization, and we have gone through the turmoil of teenage years, and then we have matured into a more professional organization now. So we were established in 1992 in Switzerland, in Lugano. And currently, we have 52 national member organizations. So that means we do not cover the world yet. And we're still increasing our membership every year. So we're creating new groups every year. So for those that don't know the flags on the previous slide, these are the countries, and you can see if you glance quickly through it that actually we have national member organizations in all continents, in all parts of the world. Obviously, because of our geographical position, we tend to have more in Europe, but we do have organizations in the US, in Latin America, in Africa, in Asia, and Australia, New Zealand as well. So in terms of our structure, we have a board of directors, and I just wanted to point out here that you will see that we have a very good geographical spread among the board. So we make sure that we have key people from each region, and in fact we are right now bringing in someone from Asia as well on the board. So we'll have someone to cover Asia, we've got someone to cover Australia, New Zealand, US, Eastern Europe, Latin America, and we are looking into bringing someone from Africa. We actually had a South African board member until a few months ago, and then we had the election. So we try to really have a geographical representation, and the same with our medical advisory panel. You can see that we've got people from all over the world that work with us. And then we also have a staff. So just to give you a flavor, up to 10 years ago, IPOPI was driven on a voluntary basis. Then we recruited a part-time executive director with a part-time administrative person, and we stayed like that until 2010, when I joined, and then I became the full-time executive director, and now we have a full-time health policy and advocacy manager. We have a full-time communications project manager, and we've got an administrative person with us in the executive office, and we've got a financial staff. So we're still a small team, and the reason we've been able to achieve so much is by having a very strong staff, a very strong board, so we work together a lot, and of course we outsource consultants depending where we go with a campaign. So we do hire people for project-specific jobs. We have 4 strategic objectives. The first one is to improve diagnosis and care. The second one is to strengthen our network of national member organizations, to increase our visibility. And until this year, now this plan will change as of next year, but until this year, we focused a lot on governance, on making IPOPI a more professional organization. So that was a very internal objective, and we established standard operating procedures for our staff. We hired more staff, and we have professionalized the way we work, bearing in mind our strategic plan in everything that we go for. So key factors in developing a sustainable global organization, I think, as I said, we've come quite a long way since 1992, but we're still looking at how to improve the overall efficiency of the organization. Just 2 weeks ago, I had a meeting with the president of the World Federation of Hemophilia, asking him for some advice. So we always have this dialogue going on with the hemophilia community, and it's been very helpful to us to develop our own SOPs and to develop our own strategic plans. Since we've had our staff, we've been able to almost double our national members. So in 2010, when I joined, we had 27 countries. And now we have 52, on the verge of having 53, actually, because Slovakia is joining in the coming days. So you can see that in 4 years, we actually achieved a lot in terms of building our membership. Actually, we achieved as much as in the first 18 years. And that's by really being very strategic about how we do things. And we expect all these new countries to join this year. So you can see Senegal, Zambia, Singapore, Indonesia, Vietnam, Slovakia, I just mentioned. So we will keep growing as a global organization. And I think really the success that we've had is rooted in these 4 key factors. It's having a really efficient strategic plan, having a robust fundraising plan that is tightly interlinked with your strategic plan, having strong partnerships with the national member organizations, and that is a very important one, and having good stakeholder collaboration. I think we talked a lot about that this morning. So when you look, if you would look at our strategic plan in more detail, you see that usually we have a 5-year plan. It's a living document, which means that we give ourselves our strategic directions for a 5-year period, but we will review action plans on a yearly basis, making sure they fit, but making sure we also leave our mind open and some flexibility to tackle upcoming issues that maybe we didn't anticipate. Again, our strategic plan has very clearly built-in programs that have international, regional, and national scopes. And at the same time, we use our strategic plan as a review tool for our activities. So we make sure that we review every year what we've done in the year, whether we stick to our plans for the year, what we have achieved, what we didn't do right, what went wrong, and we try to constantly improve that. And in the next plan, we will have actually a specific strategic objectives on increasing partnerships with stakeholders. So it was nice that I could speak about that today. So if you look at our fundraising plan, as I said, it's closely linked to our strategic plan. And the way we've organized ourselves is that we have sponsorship opportunities for corporate partners that either are there to sustain the core activities of the organization or that will look at specific ad hoc projects. So we have a kind of dual approach to fundraising when it comes to discussing with our corporate partners. And what we make sure to do is that the plan comprises every year realistic and achievable projects. So we will not take on any projects that we know we cannot achieve. And that means that sometimes we actually turn down projects, but we've been able to increase our budget over the years. Year after year, we are increasing the budget by making sure we stick to our plan, by making sure that we don't overdo it. And we still manage to do a lot, but we can't do it all, and it's all about really setting your priorities. Another important point is that obviously you plan to identify projects that have objectives that are meeting your patient community's needs, but at the same time that can also be attractive to your sponsors. So there's a gain for both parties, and that's quite important as well. So we are constantly looking at ways to also broaden our network of supporters. And in 2010, I think we had 5 or 6 corporate partners. Now we have about 13. So the way we've done it is that we've diversified, and we don't only work with the plasma industry, anymore, but we also work with the diagnostics and with the medical devices industry. And they are obviously, smaller companies, but it brings a mix of different corporate partners that really contribute also to the type of activities you're going to do. And it's been great for us. And certainly, it's been a key factor in making us a more sustainable global patient organization. So I said it before, I think another key factor is to optimize your resources. Don't take on projects for the sake of taking projects. And I think, for a lot of patient groups at the beginning, the strategy is an opportunistic strategy. You take what you can where you can. And of course, I'm not trying to say you should miss on a good opportunity. That's why we try to remain flexible. But if you have an opportunity that was not planned, you have to look at whether it fits with your current strategic objectives and whether it's not going to deter other projects that you are doing. And if the answer is, that's fine, we can do it, then you take it on board. But I think the baseline is make sure that you are very realistic about achieving your yearly plan objectives, because that will strengthen the credibility of your organization. And that means that partners, and that's not only the industry, but doctor groups and other groups, will see you as a group that brings outcomes, that has concrete achievements year after year, and then you become a trusted partner for your stakeholders. In terms of staff expansion, some people say IPOPI was volunteer-based, so in 4 years we now have six staff. And some people think that went too fast already, and others think, maybe we could have 2 or 3 more. And I think it's all about finding the right balance and expanding your staff as you need. And it may be that in some regions you will just need to hire per project consultants at first. So that's still how we are working, and little by little we have a development plan in terms of staff resources that we work on, and year after year will increase. We probably won't get to 35 staff members like the World Federation of Hemophilia, but probably in a few years we could have 8 or 10 staff members, and I think that will respond to our needs then. And of course, one of the difficulties when you hire staff is your regional priorities, because they can change. You can have Latin America for a couple of years and then Asia. So how do you go about that? So you have to really integrate that into the thinking. At the moment, my approach is that I've centralized my staff. And I think if I have regional managers, I'll centralize them as well. And that's how World Federation does it as well at the moment. But, we evolve, but it's worth thinking about that, I think, when you're a global organization. Partnership with NMOs. I think our growth would not have been possible without a commitment to engage into a partnership with our NMOs. Because as much as we do skills building programs for NMOs, we also stay realistic that we learn from our NMOs. We don't pretend we know it all. And we have a lot of NMOs who have great projects, who come up with great ideas, and having this interaction and this dialogue back and forth has helped us a lot as an international organization. So I think really making sure you have this strong partnership in place is key. And I'm not pretending it's easy, because the more NMOs we get, the more difficult it is to do that, the more difficult it is to stay in touch and to also monitor the level of activity of an NMO, because by nature we know the smaller NMOs may change leadership. You may have people change jobs, and that can impact an NMO that is purely volunteer-driven. So we know that's an issue, and we're trying to identify the best way to monitor the situation and help where we can. And for example, we do a yearly membership survey to make sure we monitor the activity level of the NMO. So all these tools are getting into place to make sure we stay connected as much as we can. I talked about the skills building workshop, so I won't talk more, but you are a more efficient global organization if your national members are more efficient organizations. So it's very important that you build in programs that help to basically make your NMOs more efficient patient groups. And so that's why we have our workshops. We have, I guess similarly to this a little bit, we have our yearly patient leaders, or biennial patient leaders, so every 2 years, where we bring patient leaders from all around the world together during the big scientific congress on PID. So usually you have 2,000 doctors in that congress, and we bring 100 or 150 patients, and we have 3 or 4 days of very patient-centered lectures and workshops, and this is always a great, great opportunity to exchange ideas. And I'm very happy to see that there were many people in this meeting, because I think it's a very valuable way of staying in touch as well. So in terms of partnership with NMOs, I should also mention that we have NMO project and programs grants. So beyond building skills, we also sustain our NMOs financially. And it's not always huge amounts, but we do help where we can. And especially when your NMO is starting, it can be a great help to have these programs in place. We tend to obviously have travel grants available when we organize meetings. And then we have grants that are specific for projects. So we have advocacy and awareness campaign grants. So the best advocacy campaign projects get funded. So there's a little bit of competition because we cannot fund everyone. But that stimulates the thinking of the NMOs, and it stimulates programs, and it helps to drive them at the national level. And then I mentioned we've supported quite a lot of national campaigns during World PID Week. And we also have a website building toolkit that enables a new group to build their website for free. So we also have international surveys. And the value of successful NMOs at a country level, not only, what did I want to say? Yes. So, well, that's what it's my point from before, that having a successful NMOs will contribute to you being an efficient global organization as well. Surveys, I mentioned that before, so this is something we do a lot in partnerships with our NMOs. And of course, data gives you credibility with various stakeholders. And then stakeholder collaboration will make you a more sustainable global organization. We learn every day from others. And there's no reason we could not learn from you. So, you know, we learn from every group we work with. And so this is just a list of all the stakeholders that matter to IPOPI and that has contributed to making us a more efficient group. It's not only other patient group, but it's industry, it's politicians, it's doctors, it's nurses, it's institutions, it's NGOs. We've worked with an array of people that make us a more credible and stronger global patient organization. Now, another key factor is to focus on regions. So you saw this slide, and I talked a little bit about it regarding the call for action. But actually, I'm showing it to you to demonstrate another point, is that when we go in a region, what we try to achieve is the snowball effect. So if we focus on 2 or 3 countries in a region, often what we see is that suddenly doctors from these countries, we put them in touch, they start speaking together, the patients start speaking together, and then we do regional collaborations in the region, and that's how we bring about more NMOs. So we've been really able to develop new patient organization by having a regional strategy. And that's worked super well in Southeast Asia. So since the beginning of 2014, we've launched 4 groups. We'll launch 2 more, minimum this year. So you can see that in a matter of two years, we would have launched 6 new patient organizations, which is great. And we've done the same in Africa, and we've done the same in Latin America. So think about your regional collaboration and identify your opportunities. We know that in Latin America, they have a big congress for the doctors. So we usually organize all regional patients meeting back to back, and we get special conditions, you know, and it's easier to organize them. In Africa, we're now doing the same with the African Society for Immunodeficiencies. So that's when we'll be in Algeria in 2 months. and we'll do the same. And we bring in more and more people. You can see more and more every time. This was the first one in Latin America. This was a later one. And this is the first one in Africa. And each of these people will go back home and try to launch an NMO. Another key factor for us has been our scientific congress. So I told you we organize regional and international patients meetings, but now we also lead an international scientific meeting. So this has a scientific program, and it's focusing on the clinical management of PID, because we realized that the other scientific international events were really focusing on research in the field, but not so much the clinical implementation of the research and the management of the conditions. And so we identified a gap, and it's worked. So we had a very nice, successful first Congress. We had over 400 people. We couldn't believe it coming to the Congress. And now we're organizing the next one this year. And we will make them every 2 years. So we will alternate with our international patient meeting. And that has built our credibility hugely with the doctors' groups who all work with us and thought, what a great idea. We're on board. We're going to help with that. So they're working with us. And again, that's a good example of stakeholder collaboration, but also how you can use a program like that or a congress like that to build your credibility and to give your organization a higher visibility. And World PI Week, I had mentioned it. I mentioned Plus. I don't think I need to do that again. Diversification of your media tools to increase your organization global visibility. And I know Shane will talk about communication, but I think that is something we're constantly trying to improve. We will launch a new website soon. So we're going to improve our website. Frank mentioned the video, testimonials. This is a very strong tool. We're using them as well. Patient leaflets. We have a map where you can find out the status of SCID newborn screening around the world. We also have a database of treatment, so people can know what treatments are available in their countries, obviously social media and so on. So this is another, for a global organization, another way to increase your visibility. So I think that through the implementation of an efficient and realistic strategic plan, a robust fundraising plan, and successful partnerships, we really have been able to increase our level of activity tremendously in the last 5 years. And we certainly, as IPOPI, we're committed to keep doing that and to further develop as an organization working for PID community worldwide. I think in terms of geographies, don't try to spread your wings too fast. You're just starting with Alpha One Global, and it might very well be that the snowball effect I talked about will work for you as well. 5 years ago, things were happening in Latin America. And so our regional focus was on Latin America. Now things are happening in Southeast Asia. That doesn't mean we're not doing anything anymore in Latin America and Africa, but we're intensifying our efforts in one region, and that might be worth thinking about when you look at your strategic plan. And I think at first, the board members have a key role to play. So we've been strong because we've had strong board members who are committed to drive change in their region, who are committed to stay in touch with the countries they are responsible for. So each of our board members actually has a regional responsibility. Roberta is based in Argentina, she does Latin America. Dragana is based in Eastern Europe, she does Eastern Europe. Bruce is in Asia, he does Asia. And that has really helped because you don't have that much staff when you start, so you have to have good volunteers. And building new NMOs, the first step will always be the doctors. Identify the doctors in a country and identify which other patient groups are there and start with them. Start working with them. And then, you will be able to progress. And in conclusion, I think, the last thing I wanted to do today is to sound like we know it all. So I have a very clear statement that we still have a lot to learn ourselves, but I just wanted to share with you the approach that we've had in the last 5 years. It's worked for us very well. So hopefully, maybe you get a few, ideas or, out of this presentation that can help Alpha One Global to grow, and obviously we'd be very pleased to stay in touch and help where we can. Thank you.